Record to this computer.
Okay, there.
Yeah, ma'am. It has started now.
Okay, amazing. Mm, okay, so I think most of the participants are here and we are ready to start with our today's webinar. Thank you so very much, everyone, for joining us today for this insightful session that will be led by Ms. Afra Arshad. It's an absolute pleasure to welcome you all to our today's workshop on trauma-informed therapy. Afra is a compassionate and experienced clinical and counseling psychologist with a master's degree from Beekhouse National University. Her strong focus on adolescent counseling, a solution-oriented approach, and a deep commitment to mental health and well-being makes her bring a wealth of knowledge to this space. She's worked across leading institutions like Fatma Memorial Hospital, Services Hospital, LAMS, along with a specialization in substance abuse and drug addiction. She has earned, through all this experience and her commitment to not just gaining knowledge, but also, also spreading that across, her time span while she's been working. She has that has made her a respected name in the field. She's also the founder of Teen Therapy Wellness and a licensed member of prestigious associations, including American Psychological Association. She continues to inspire and educate with both empathy and expertise. We're really honored to have her as a senior trainer at IPA, and we're really honored to have her with us today and look forward to gaining valuable insights from her on this critical and sensitive topic. Please, yes, Afra, over to you now. Thank you so very much for joining in today.
Thank you so much for having me. Hello and warm welcome, everyone. I am Afra Arshad, clinical and counseling psychologist and a workshop trainer at Institute of Professional Advancement and the founder of Teen Therapy Wellness. Today we are going to be talking about something that's very personal to me. That is something that I've always wanted to have a workshop on. And we will not be just focusing on what it actually means by trauma informed therapy. We will be focusing on how does it feel to be part of people's life who have been through trauma. How does it feel as a professional? What can we do to support them with empathy rather than working with them through urgency? So, before we begin, I would like all of you to be comfortable wherever you are, and let's just take a deep breath with me. Make sure that you have kept your back straight, and I want all of you to relax and inhale with me and exhale. Tell yourself that you are here, and that already means that you are committed to compassion, to growth. Here's to learning, here's to getting better, and here's to helping others and ourselves in healing. All right, before we talk about trauma and trauma informed therapy, I would like to ask that can you tell what's the word, first thing that comes in your mind when you hear the word trauma? What does it means to you, or what's the one word that you associate with the word trauma? You could write in the chat box or you can unmute yourself.
Um, I think
Ah,
for
yeah.
me, the word comes negative memory.
Right. Negative memories. Perfect. Thank you, Natalia, for sharing that.
I think for me, it is a wound that keeps reoccurring.
Sorry, Sabine, I didn't get you. Can you please repeat?
A wound that keeps reoccurring, reopening. It doesn't heal.
It doesn't heal, it keeps on reopening. Perfect. Thank you so much. Sumaya has said memories. Una Khan has said emotional wound.
I guess it's unforgettable memory of something from your past, which is like keep on coming back and effective and affecting your like ability to work in daily life.
Perfect. Perfect. Thank you so much for sharing that, Zobia. There's no right or wrong answers to that. It's just our instinct, our gut feeling, what we associate or what comes to our mind when we hear the word trauma? So definitely there's a lot of different responses. Some said negative memory, some said emotional wound, right? Some of us might think of trauma as pain, as resilience. So it basically tells us that how varied trauma can be. It's never a one size that fit all. Everyone has their own experience, own way of describing trauma. It could be related to abuse, to insomnia, irritability, drugs abuse, anxiety, fear. There are a lot of things that is associated with trauma. And this range is what basically makes trauma informed work so important, because in trauma informed we are not focusing on what we know about trauma or what we have learned about trauma. Rather than we are focusing on what client has experienced, what the other person is going through, and what's the impact of that trauma on that person. That's what we focus on when we talk about trauma informed therapy. All right. Moving on, it's really important to understand what is trauma actually, and it's not just a bad memory or a tough time. Trauma is basically it's a distressing experience. It's something that can overwhelm our natural coping mechanism. We're not able to cope up with it. It's like a wave that crashes over us and it doesn't allow us to breathe. Trauma can be due to big major event like a car accident, like a natural disaster, or it could be something that happens over time, something that's happening gradually, like emotional abuse, neglect. Now, we cannot say that there's only one incident of abuse that causes trauma, but there was, maybe years of abuse, years of neglect, and that happened gradually, that causes trauma, right? So there's a lot of variety in trauma when we talk about the definition or the term of trauma. Aksa has said painful memories. First word that comes to mind with trauma is pain, not just physical, but emotional and psychological too. Yes, thank you so much, Aksa. That's exactly what we were talking about when we say the word as to what terms comes to our mind when we think about trauma. All right, now moving on to trauma-informed therapy. Now, that is the most effective therapy that basically recognizes and understand the influence of trauma that it has on us. Trauma-informed therapy teaches us that instead of labeling a person as a difficult or uncooperative, we ask them what may have happened to you that's causing this behavior. We're not asking what's wrong with you. We are simply asking what happened to you. What's the reason behind your behavior? And that's the major shift that has created a safe, non judgmental space for healing. When you ask your friend, what's causing you this behavior? What's the reason behind this behavior? You will feel that the other person might start expressing or telling you the things that's happening with them, rather than if you ask them that what's wrong with you? What happened to you? And they might just tell you nothing happened with me, nothing's wrong with me, right? So trauma is not always about what happened to someone, but how your brain and your body held on to that trauma or that incident that caused you emotional stress. For example, if there's a student who cannot focus during the studies, so he or she might not be lazy. There's a reason behind the not ability the reason behind not being able to focus or concentrate during the classes. They might be in survival mode during that time. There's a client who is avoiding therapy. It's not necessary that he's resistant or he's stubborn or he's too much of himself. There's a reason that he might be protecting themselves. They don't want to talk about it. They are resisting to express their emotion, but we're not going to label them as a resistant or uncooperative. According to you guys, what are some situations that you think might be traumatic but are often overlooked by our society? Our society is not taking that as a traumatic event, but according to you guys, it is have a negative impact or a traumatic event to you. Anyone who would like to share or say something, any situation you think might be traumatic but are overlooked by our society?
I think constant judgment from the family or like from parent side to like from a very early age. A very very light comment on like somebody's weight or the way they look, or we don't realize it after certain time. It's like, if as you said, that it's not just one incident, it could be like ongoing thing. So people think that, especially in our culture, it's very normal to pass a comment on somebody, like छोटे बच्चों से लेके बड़े तक. We are facing it, I think, throughout our life. We are lacking that sensitivity here.
Very true. Thank you so much, Zobia. That's basically that we are being constantly compared to family members, to relatives, to our cousins, that the other person has scored so much in their college or university, and look at you, what you are doing. So that this behavior might seem normal and common in our families, but it can definitely deeply affect your self-worth. It can create lasting emotional wounds, but it's being overlooked by our society because it's something that's happening in almost every household. Zainab has said death of pets. Very true. We do not, we take it very lightly that so what if your cat got sick and he or she passed away? So what? It's not a big thing. You will get a new one. But no, it can leave a negative impact on you. Friendship breakups, definitely. It also has a very traumatic event, and sometimes it's very difficult to move on or to get over the pain that you get from losing your friend. Umna has said unsupportive people around you. Yes, definitely. When there are people around you who are not supporting you, and they're not pushing you to do something better in your life, that can also leave an impact. There's one more situation that I would like to add on, is the fear of failure or the academic pressure that the students are going in, especially in those universities where there's a lot of competitive cultures. So the students, they have started internalizing shame and anxiety because there are a lot of expectations from them, and that is also the trauma is present, but it's overlooked by society. And when we tell those parents or the people that you're pushing your child too much or you're putting too much expectations on them, so they always come up with excuse like, our parents also used to do that, and we all have been getting scholarships, but why this child is not doing up to that level? So that can also leave a traumatic event, a traumatic impact on us. All right, thank you so much for sharing. Let's move on. All right, so
Ma'am,
now
I also think that when
yes, 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 Natalia, please continue.
I also think that when parents divorce or go through separation, the way that
Yes.
impacts and affects children is also
Def-
overlooked.
Definitely. When parents are going through such traumatic experience of their life, the children are being neglected. No one asks how the children are doing or who's going to look after them. The main focus is on mostly on the parents at that time, and the child suffers a lot. Definitely. Thank you for sharing that. All right. Now that we understand what trauma is, and how trauma-informed therapy is important when dealing with traumatic individuals, we are going to talk about the types, because trauma is not one size fits all. There are a lot of different forms that are going to help us respond more effectively, and they are typically organized into two, seven, and three types of trauma. Part one is two types of trauma, in which we focus on big T trauma, that's basically major life threatening events, and little T trauma, that's non life threatening, but it can be emotionally distressing as well. When we talk about trauma, when we talk about intense emotions, we mostly associate trauma with major events, with massive events like, car accident, like natural disasters or things like that. They are basically called big T traumas. They are shocking, they are clearly traumatic events that overwhelm us instantly, right? But what many people overlook is little T trauma. It's the smaller, repeated experience that chip away at our sense of safety or worth over time. For example, if someone is being bullied at school, if someone is being constantly criticized by the parent, if they are experiencing shame, rejection, these are little trauma. They comes under little t trauma that people overlook it. But both of these trauma have emotional impact and they require help, they require healing. Moving on to seven types of trauma. Okay, now we're going to discuss one by one. And it is basically trauma can be categorized on where the trauma has happened or how it has affected the people in society and across generations. The first one is life transitions. Unexpected changes, like Natalia just mentioned, divorce, separation of parents, losing a job, having miscarriages, or retirement. These are the major changes in our lives that can leave a lasting impact. And they comes under life transitions traumas. Then we have vicarious trauma. It often affect those individuals who are helpers, who are, social workers, who are therapists like us, who are providing counseling to individuals who are going through trauma, and they basically absorb other people's trauma, other people's emotions and their stories. And that can also have a impact of that trauma onto that individuals who are helping others. Then we have complex trauma. Complex trauma involves multiple and layered traumas. They are layered basically, that comes mostly from childhood, and they comes from childhood and they are like ongoing traumas that's been going on for a longer period of time. That can involve our relationships, the level of trust, these things like these things that can have an impact that's so distressful and it's so long that we feel like we can never come out of it. Those traumas come under complex traumas. Sometimes, if individual has grown up with a neglectful parent or abusive person in the family, that trauma could be a part of complex trauma. Then we have historical trauma. These traumas are basically passed down from colonization or the trauma of slavery. For example, the trauma that's being experienced by Israel-Gaza conflict. Now, these traumas can impact thousands of civilians because of there's a lot of deaths, there's a lot of displacement that's going on, and now they are suffering with severe PTSD. They have developmental delays, they have collective grief. That's historical trauma. Now we have intergenerational trauma. Now, those trauma that is inherited or passed down through family behaviors or emotional responses, and mostly in these intergenerational trauma, we have not faced or witnessed the trauma by our own self, but it has been passed down to us from our family members. A woman who has been facing domestic violence for a long period of time, but she has been staying silent just for the sake of a family, there's a possibility that she might raise daughters with suppressed self worth or sons with normalized aggression. Now, the son is not aware that where is the aggression coming from, but it's passed down through generation to generation. I hope it's all clear. If anyone have any question, they can ask in the chat box and I will answer that. Now we have collective trauma. Collective trauma is when the entire society or the group is experiencing something distressing. even if the individual have different personal responses to that trauma, but the community as a whole is changed. Like when we experience COVID-19, that is a collective trauma that each one of us went through, and we all had a different responses, personal view or personal impact, but as a whole, we all changed. It all changed us. Then lastly, we have acute trauma. That is basically the result of single intense incident, like there's a robbery in the house or sudden loss of a loved one. That's acute trauma. The impact of that incident is immediate and very intense. It can happen to anywhere, anyone, and leaves people in a state of shock, in a state of fear. And sometimes acute trauma is invisible as well, because people move on from that. People, they seem fine to us. But just because it was brief, it does not mean that it was small. Just because they are carrying it so well, it does not mean that it's not present. All right. Now, the part three is acute, chronic, and complex trauma. Now, from a clinical lens, trauma is also categorized by how it occurs. And mostly these types, they do overlap with each other depending on the severity or the reason behind the trauma. Acute trauma, like I just discussed, is a part of a single incident, and complex trauma is also a part of multiple layered traumas, as we have already discussed that. Chronic trauma is when exposure is repeated over time, like long-term domestic violence, long-term bullying. So that's part of the chronic trauma. These are the types of traumas that have been categorized only for us to understand them better, right? Which of these types do you think is mostly commonly ignored in our community or in our profession? What do you guys think?
Acute trauma and vicarious trauma.
Acute trauma and vicarious trauma. Okay, say perfect. The professionals who are working in this field, they can relate to it somehow, because the therapist or the counselor, they are working with traumatic individuals, but no one is asking how is the therapist doing or how is the helper doing in that situation, and we mostly ignore that as well. Aksa has said acute trauma is also being ignored. Very true. The little t trauma are also being ignored a lot. Like it comes under the category of little t trauma, that if someone has experienced bullying in the school, or if someone has lost a friend or a pet, so mostly people overlook that as well. All right, thank you. Let's move on. Now, what are the 6 principles of trauma-informed care? Now, these principles, they are basically guidance to therapists, to educators, to doctors, or any supporters who wants to build trust and resilience with those individuals who have experienced trauma. The first one is safety, and the most important one, because it ensures physical safety and emotional safety in every interaction. The trauma survivors, they need to feel that they are not in danger, physically, emotionally, and psychologically. It's necessary for the people around them to create environment that is calm, that is predictable, and not threatening. Like I always suggest to other therapists that whenever you are dealing with clients with trauma experiences, make sure that you do not sit too close to them. Let the client choose their seat. Let the client choose their space. Make sure that you are not sitting too close or right in front of their face, because that could also make them feel uncomfortable. There's another example I would also like to add on. If there's a female survivor of domestic abuse that comes to you, and she shares that she feel unsafe in male dominated spaces, So make sure that you do not ever recommend her a male therapist. Try to give her a female therapist or allow her to bring a support person with them when they need therapy, when they're coming for the sessions. These little tips help the client feel safe. Secondly, we have trustworthiness and transparency. We have to be honest with the clients. We have to be clear and consistent in our actions and communications. If we do not have any therapist right now with us, if we have a student or if we have someone who have just started doing their practice or someone who's not even part of the this profession, it goes for it's for you as well. If you are a helper, if you know someone who have been abused, maybe in the family or in the friend circle, you can also use these tips when you are trying to help them. Uh, the trauma survivors, they often have trust issues because they have been abused, they have been betrayed. So it's very important to be clear about what's happening around them. Make sure that whatever expectations that you are setting, make sure that they are aware about it. And they know that what's going to happen next. Tell them how long the session is going to be. Don't end abruptly. Tell them that we are going to end it in 15 minutes. Now we are going to end it in 5 minutes. And if the client or the survivor asks you something which you're not sure about it, tell them honestly. Don't fake. Don't fake with them, because if you fake with them, they are going to know. They're going to sense it that the other person is not being honest with me. All right. Then we have peer support. Definitely, healing happens through shared experiences and relationships. The support groups that we have, the survivor circles or the community spaces, it definitely help people feel less alone and more connected with each other. So it's really important to share stories so that it can help them normalize the pain and it opens the door to healing as well. Collaboration is also very important. Let the power dynamic between client and professional be on the same level. Make sure that instead of telling the client that, I am the expert and you are the patient and you don't know anything and let me be the boss of this whole session, try to tell them that the healing is a two-way street. Clients are also the experts of their own lives. Make sure that it looks like a collaboration rather than being a bossy and someone who's controlling the client. You can use language like, let's work on this together, instead of saying that you should do this or you should do that. Right? These are some little tips that is going to help you a lot. Then we have empowerment. We have to support individuals in regarding controlling over their lives. Because when the individual is being through such traumatic experiences, they mostly feel loss of control in themselves. So this principle is about giving clients options, validating their strength, and making sure that they restore their sense of agency. Ask them, would you prefer to write? Would you prefer to speak? How do you feel comfortable right now? What topic do you want to talk about today? Give them the choice. Let them feel empowered when they are with you. Right? Tell them that, your voice matters and you can tell me if something doesn't feel right. Right? All right. Lastly, we have humility and responsiveness. Make sure that you are being responsive to them. You are constantly listening to them. Sometimes even the pauses or the silence between the therapist and the client, it plays a very important role. These silences, these pauses are also very necessary. So make sure that you're also doing that when you are working with trauma survivors. Right. Anyone would like to say something, ask a question, please, you can just go ahead. Like I said, these principles, they are not just for therapists, they are for teachers, for parents, for community leaders. And when we apply these principles, we're not just treating trauma. We are building culture of compassion. We are building a culture of healing among each other. I hope that it's all clear. If there's no question, we are going to move on. All right, now it's very important to recognize the signs and symptoms of trauma. And we have emotional symptoms, behavioral symptoms, physical symptoms, and diagnosis that you could use for the trauma individuals. All right, let's move on to emotional symptoms. Just a second. All right. So emotional symptoms are, feeling anxious all the time. There's a lot of fear. There's a lot of panic among you. There is sadness. There's feeling of hopelessness. There is difficulty trusting other people. You're not able to form relationships with each other. There is a lot of guilt because you have started blaming yourself for the event. You blame yourself. You feel ashamed of yourself that something like that happened. There are a lot of different mood swings. There are sudden shift in the mood from extreme highs to extreme lows. There's a feeling of detachment. You feel detached to each other. You're not able to form any attachment or connection with each other. Not every emotional reaction is about present moment. Sometimes it's the past that's showing up. It's the past showing up asking to be seen. Anyone would like to share any other emotional trauma that they have seen working with the clients, or someone who would like to share their personal experience regarding emotional trauma signs? Because this place is for you. This is a safe space where we can talk about our symptoms and what's going on in our lives, or if we are seeing any clients who are going through that, so we can discuss that.
I think it could manifest as defensiveness sometimes.
Sorry?
It could manifest as defensiveness sometimes.
Right, defensiveness. Yes, you start being defensive regarding everything around you. You try to protect yourself, you try to keep yourself away from uh, other people's opinions or their interactions. Because anyone else? All right, now we're going to move on to behavioral trauma signs. There's avoidance. You start avoiding reminders of the traumatic event. You start avoiding those people or those places who might have association with that trauma. There's changes in social interaction. You start withdrawing social events. You don't want to be in public gathering. You try to isolate yourself from everyone around you. There's also a lot of impact on your memory as well. You start forgetting things. It gets difficult for you to focus. And sometimes there's brain fog as well. That's also a very common symptom that I've also heard from the client telling that our brain feels foggy. We're not able to remember anything. There are also some risk self-destructive behaviors as well. There's a lot of individuals who are using substance abuse or self-harm as a coping mechanism. There's emotional numbing. People have started feeling numb. They have started feeling lack of interest in any enjoyable activities. That could be a sign of depression. There is hyperarousal. They start being tense or edge all the time. They're not able to sleep. They are re-experiencing all these flashbacks. So these are some of the behavioral symptoms. Now let's move on to the physical symptoms. Because our body, it always keeps the score, even if we don't have words. So the physical symptoms are very much associated with trauma. There's headaches, frequent headaches, and that could be triggered by the stress. You feel there's a change in your appetite. You are either overeating or you're not eating at all. There's increased heart rate. You feel palpitations all the time. There's a lot of sleep disturbance. You're not able to sleep at night, or you're not able to wake up early, or you're oversleeping. There's muscle tension. Experience stiffness, especially in your shoulders when you are going through a stress. You feel dizziness. Your head feels light all the time, and there's fatigue. You constantly feel tired, and you have low energy level. So these are some of the physical signs. Now, diagnosis. All the individuals who have been through trauma or who are seeking therapy, there are a lot of co-occurring diagnoses that could be part of their symptoms. Anxiety disorder, that's also very common with individuals who are trauma survivors. They have generalized anxiety disorder that they feel anxious regarding anything, and they are not able to figure out what's the one reason behind it because they feel overwhelmed. This panic disorder or social anxiety disorder, they may develop following the trauma. Post traumatic stress disorder is a mental health condition that's very common in those individuals who have experienced or witnessed any trauma event. Then we have depression. Like I just said, that they start feeling hopelessness, they start involving into self harm activities, and they're not able to enjoy any activity. Substance use disorder, they use substance as a coping mechanism. Adjustment disorder is also very common. This is something that I have personally seen in my clients, that they are not able to cope up with those daily stresses, and they are having adjustment issues. They feel irritated by everything that's going on around them, and they're not able to adjust accordingly. So these are some of the diagnoses, co-occurring diagnoses that could be a part of PTSD or individuals who are going through trauma. And the diagnosis is obviously only given after a thorough assessment by a professional. We cannot give diagnosis to each other as a friend or someone, oh, you are having these symptoms, so I think maybe you have a personality disorder, maybe you have depression. So it's really important to seek a professional. Only they can give you a diagnosis following observational interviewing and assessment. Any questions so far regarding the symptoms? All right.
मैम
Now,
आई थिंक आई वांट टू ऐड समथिंग
जी जी,
कि
yes
जो
please.
सबसे ज्यादा सिम्टम्स में होता है वो सोमैटिक सिम्टम्स बहुत ज्यादा होते हैं।
जी बिल्कुल.
गट गट इश्यूज बहुत ज्यादा होते हैं ट्रॉमा के पेशेंट्स में,
हम्म.
और वो उन लोग को आइडेंटिफाई नहीं हो पा रहा था कि ये किस वजह से इश्यूज सारे हो रहे हैं।
हम्म. बिल्कुल. Which somatic symptom you have seen mostly? Any particular symptom you have in your mind that client experience mostly?
यस मैम, इसमें आ जाता है इरेगुलर बावल मूवमेंट्स आ जाती हैं, डायरिया आता है,
हम्म.
इसके अलावा आईबीएस,
बिल्कुल सही.
इरिटेबल बाउल सिंड्रोम,
हम्म.
हार्ट बर्न, एसिडिटी, एसिड रिफ्लक्स।
बिल्कुल सही, बिल्कुल. There's a lot of common with the gastrointestinal. उनको पेट के काफी इश्यू आने शुरू हो जाते हैं with those जिनको ट्रॉमा का इश्यू होता है कि उनका पेट खराब रहता है, या उनको खाना नहीं हजम होता, या उनके पेट में दर्द रहता है. देयर इज नो रीजन. उन्हें स्टमक के अल्ट्रासाउंड करवा लिए, एक्सरे करवा लिए, हर चीज करा ली, एंड एवरीथिंग इज क्लियर अकॉर्डिंग टू मेडिकल रिपोर्ट, बट स्टिल दे एक्सपीरियंस दीज सोमैटिक सिम्टम्स. परफेक्ट जैनब, बिल्कुल सही आपने कहा. थैंक यू सो मच. Anyone else would like to share anything? If not, then we are going to move on. We're going to explore a very, very powerful concept in trauma informed, and that's called window of tolerance. Now, this is a model that has helped us to understand that how our nervous system responds to trauma, and how we are going to basically navigate the emotional states that's being experienced by trauma survivors. And we're going to start ideally with optimal zone. That's basically the central area of window of tolerance that you see here. Now, in this optimal zone, We feel calm, we feel relaxed, we feel focused, engaged, and in control. This is where we function the best. And this is where we can think clearly, we think rationally, we regulate our emotions effectively, and we respond to the challenge that we experience very constructively. This is basically your sweet spot where you can, engage with your life's demands without shutting yourself down, without feeling overwhelmed, without, being in any sort of state where you feel disturbed. Now, what happens when we step outside of that window of tolerance, that optimal zone? Above the window, as you can see, we enter the state of hyperarousal. That's the top of the diagram. This is where our nervous system goes into overdrive. That feels oftenly we feel triggered by, by feeling threatened or by any physical or any trigger that we experience around us, and we start feeling, we have racing thoughts, we're feeling butterflies in the stomach, we're trying to run, we try to fight, we panic, we start sweating, we're not able to relax. That's hyperarousal. We have pounding heart, palpitations शुरू हो जाती हैं, हाथ कांपने लग जाते हैं. These are the symptoms, and these are basically, it comes under, fight or flight response. In hyperarousal, our fight, flight, or freeze response is activated. Even if there is no a physical threat, you cannot see any threat right in front of you, but still your internal alarm system is activated. I'll be discussing the 5 F's with you in the next slide, the fight, flight, freeze, fawn, and flop response. I'll be discussing that. For now, let's just focus on the window of tolerance. Now, at the end of the spectrum, as you can see, there is hypoarousal. Now, this state occurs when our nervous system becomes underactivated. It's basically a protective mechanism when we feel completely overwhelmed or shut down. We start feeling numbness. We start feeling dissociation with our emotions. We feel empty inside, like you are experiencing detachment or you are shutting yourself down. In this state, you might feel frozen. You might feel that you're not able to act at all. You feel disconnected from yourself or your surroundings. And that's basically the way, it's your body's way to conserve energy when it feels too much to handle. Now, these are the very important आप कह लो concept that's we need to understand this कि हमारे पास अगर कोई इस तरह का client आ रहा है who is coming from a traumatic background, in which state that person is and how we are going to bring that person back to the optimal zone. It's important to understand what are the things that are shrinking your window. As you can see on the left side of the diagram, there are some reasons that could be the stress, anxiety, there's rejection, there's shame, there's guilt. When we are experiencing these things consistently, our nervous systems, it becomes more triggered, easily trigger हो जाता है इन चीजों की वजह से. And our capacity to stay in calm in these situations, it diminishes. We're not able to keep ourselves calm. It's like our internal space for resilience, it becomes smaller. And now, what are the things that can help you to expand your window? These things, they are basically, it gives you the capacity to handle your life challenges while staying in your optimal zone. Like we have mindfulness, we have being aware of our present, our feelings, our thoughts, our emotions. We can do positive talk with ourselves. I will be telling you more about positive self-talk and deep breathing. That's also very effective. I will also be conducting that with you in the next slide. Then we have grounding exercises that can help you use your 5 senses and get back on the present moment. And lastly, physical activity. Going through a walk that actually helps you regulate your nervous system. So, in summary, understanding your window of tolerance is a crucial step towards feeling better about yourself, being able to regulate your emotions and your overall well-being. Optimal zone is where we thrive, we feel calm. Recognizing the signs of hyperarousal and hypoarousal, it allows us to intervene. It allows us to help us to look at the techniques or the strategies that can help us to bring back to optimal zone. And most importantly, try to incorporate practices like mindfulness, deep breathing, because it expand your window of tolerance. It expand your capacity to navigate your life's inevitable ups and downs, and it helps you to create greater resilience. What other things can you mention that will expand your window other than these things that I've just discussed with you all? और इसके अलावा क्या चीजें आप लोगों को लगती हैं that can help you or the trauma survivor expand their window? Some quick tips anyone would like to share?
A
I
good
guess,
social network.
Social activity, socializing, gathering, talking to a friend, calling to a
yeah,
friend,
talking to
meet
a
up.
loved one and to whom you can connect to actually. It's not always blood relation or not always somebody very like living close to you, but somebody you can connect like mental level पे.
जी बिल्कुल सही. Someone that you can connect with, that would also help you to expand your window. Anyone else? All right. Now these are the positive talk that I've just mentioned. That can help you expand your window. Things like sentences like I am worthy as I am, and I always have been and always will be. My trauma and feelings are valid. I want all of you to read those sentences and repeat with me. Like I am also reading those sentences. I want all of you, whoever can see the screen, repeat those sentences. Say it out loud to yourself. I'm enough no matter where I am in my healing process. I'm not weak for having feelings or struggling. I can get through this. I can heal. I will not give up. I didn't deserve any of it. It was not my fault. So these are some affirmations that you can use for trauma survivors. Anyone else who would like to add on some other statements जो आप लोगों ने शायद कभी अपने लिए इस्तेमाल की हो या अपने clients के लिए आप यूज करते हो? It actually feels amazing to read those sentences. Sumaya has said, if it hurts, it matters. Very true. Very good. और chat box में बेशक लिख दें. It's nice to read some more affirmations from your side as well. Anyone else who would like to write something? This too shall pass. बिल्कुल सही. Perfect. It's a long way, but I will get there. Perfect. बिल्कुल सही. Excellent. All right, let's move on. All right, so we are going to do deep breathing. I want all of you to be attentive for a while. Uh, Make sure that you are in a comfortable place. आसपास कोई शोर ज़्यादा ना हो. Headphones हैं तो headphones लगा लें. That would help you a lot. We're going to do a deep breathing exercise. Aksa has said, what happened to me does not define who I am. Definitely, perfect. This is what trauma-informed teaches us. Ke what happened to you does not define you. We're not going to label ourselves because of what happened. All right. Are you all ready? I hope that you all are ready because we're going to do a little exercise of deep breathing. I think we all need to relax ourselves a bit after having such nice discussion.
So often, we're caught up in life's demands with no time to stop. But becoming more aware of your own thoughts and feelings and what's around you, and accepting the present moment, can help improve your mental health and well-being. Doing this affects both the mental and the physical you. Some people call this being more mindful. Focusing on the present means paying attention to your thoughts and feelings right here, right now. Breathing exercises are a great way to focus on the present and be more mindful. Doing this can also help when you're feeling stressed or anxious. This short video will take you through how to do a mindful breathing exercise. Firstly, settle into a natural, comfortable position. When you're ready, take a deep breath in and a deep breath out. Breathe naturally, noticing the sensations of the breath entering and leaving the body as best you can. Allow your shoulders and neck to relax, focusing on your breathing, just being aware of it. Focus on how your body feels. What sensations do you notice? Do you feel your feet on the floor or the feeling of your clothes on your skin? Take this time to pay close attention to physical sensations, from the top of your head right down to your toes. Notice what you're thinking about right now and how you're feeling. Just take the time to notice your thoughts and feelings without judgment and without trying to change them. When you're ready, take one more breath and try to bring this awareness with you into the next moments of your day. Breathing techniques like this one can help to center you in the moment at any time and connect you with the present, which can help if you're feeling stressed or anxious.
All right, we are done with that. Anyone who would like to share their experience, how they are feeling now after doing this exercise? Because I'm feeling relaxed and I needed this exercise. All right, anyone who would like to share how they are feeling?
Yes, ma'am. After doing this exercise, my mind feels more clear.
Right, true, very true. Akshay said, I'm feeling calm and relaxed. Muna is also feeling relaxed. I'm also feeling relaxed. Acha, I always try to do this exercise during my workshops, and I always participate as well. I also conduct, I also मतलब मैं खुद भी practice करती हूँ जब भी workshops के दौरान because it helps me to relax as well. All right, let's move on.
So often, we're caught up in life's.
All right, moving on to a very important part, that is how does trauma affect the brain and the body? We are going to discuss briefly the profound impact trauma can have on both on our mind and on our body. All right, now let's look at the two main areas of impact, the brain and the body. And first, we will be focusing on the brain. Just give me a second. All right, I am back. So we will be discussing about something that's very important, and I think we all need to have education about this as well. We are going to look at the two main areas of the impact. The first one is structural and functional changes that we experience due to trauma. It definitely alters normal brain functioning, and it alters the way our brain responds to stress, alters the way it responds to emotional regulation and our memories. The key regions that are affected and involved in the trauma, I'll explain each of the region with examples so that you have a better understanding. The first one is amygdala. Now, that's the area of your brain which is responsible for your emotional processing, the way you experience fear, the way you experience anxiety. Now, this area becomes hyperactive, and that leads to feeling heightened anxiety, heightened vigilance, heightened stress. Think of amygdala as your brain's alarm set. After trauma, it can become overly sensitive. It can lead to heightened anxiety due to oversensitivity and an almost consistent state of vigilance. For example, किसी का कोई कार एक्सीडेंट अगर हुआ है तो that is a constant state of vigilance because they might, they might punch someone, they might panic at a sudden loud noise. Even years later, they see something like that or experience something like that. ठीक है, कोई ऊंची आवाज अगर उनको सुनाई देती तो शायद उनको पैनिक अटैक आ जाए. दैट मीन्स कि आपका एमिग्डाला हाइपर सेंसिटिव हो चुका है. Now, the second part is hippocampus that shrinks when we experience trauma. And that is the area which is crucial for memory. Obviously, when it's shrinking, it's impairing our memory function as well. And it can contribute to those intrusive memories, those intrusive flashbacks or nightmares that we experience, which are part of characteristics of PTSD as well. It's just like that you are trying to piece together a coherent timeline of events, but your memory is definitely fragmented. You feel brain fog and you feel jumpy all the time. Last and the most important part is prefrontal cortex that shows reduced activity. And that part is basically our brain's CEO. That's like responsible for decision making, for emotional regulation, and most important part. So when its activity is reduced, obviously it's going to become difficult to think rational, to make good choices, even to manage strong emotions. We're not able to do that because of reduction in the activity in prefrontal cortex. And that might manifest as difficulty concentrating at work, struggling to calm down after an argument, or not being able to keep ourselves balanced. These are the key regions which are affected, and that's how they impact on us. Now, moving on towards the impact on the body. Now, that is also a very important part. Like I think Zainab mentioned about the somatic symptoms. Psychological distress can manifest as physical pain as well. There's no medical condition, all the reports are fine, all the tests are fine, but still there is, pain in your stomach or on your shoulder or in your muscles. So that can have, trauma can have somatic impact on the body. Common manifestations like headaches, like gastrointestinal issues, muscle tensions, they are the most common manifestations of trauma that is visible on the individuals. And interconnected impact. That's like the physical symptoms, they're intertwined with our mental health as well. So PTSD, anxiety, depression, they are basically creating the discomfort and distress. And it's the cycle that's been going on. You are anxious because of your stomach issues. Stomach issues is caused because you are anxious. So there's a cycle that's been going on. And that's how trauma is affecting the brain and the body. And it's very important to know these impact when you're dealing with clients. You have to educate your client as well. That's how much That's how much intense the impact of trauma is on us. All right, let's move on to the trauma cycle. All right, now this is the very, what should I say, very important part again. And I think that even when I was making this presentation, I actually learned some new things as well when I was making this, working on this trauma cycle. So this cycle is basically, it highlights the pattern that, the individuals find themselves in a repeated manner. It keeps on repeating again and again and again and again. We are going to briefly walk through the series. So the first one is triggered. So the cycle, it begins when the individual encounters a trigger, something that, reminds them, something that consciously or unconsciously, you meet someone, you see someone, you smell something, you see a decor somewhere, or any potential triggers that could traumatize, that could make you get back to that place. That's how, you feel triggered. So it starts the moment individual feels triggered, and then the trigger lead to the feeling of being re-traumatized, where the intense emotions, intense sensations of that original event is re-experienced again at the present moment. Now I would like to shed some light on re-traumatization, and then we'll come back to reaction and response. All right, now re-traumatization is something that can make us feel like we are in that moment again. And I would also like to share one thing that when I was marketing this workshop, there was this individual who wanted to be a part of this workshop, who wanted to learn about trauma and trauma informed. And she kept on messaging me on daily basis that today I will register, today I will do register. I forgot, today I will register. Until she told me that she's afraid of being in the workshop because she was afraid that she might not be able to cope up with it if she experienced anything again. So that's re-traumatization. When we talk about the trauma, we feel scared that we start feeling the experience those emotions again. And that's the part of therapy as well. When you are in the therapy, you have to, sooner or later talk about it in order to heal. So that's, she basically lead me to make sure that I bring this up in the workshop as well, that what is re-traumatization, and how individual feel when they get triggered or they experience something like that. All right, now this is one of the example that I wanted to share with you. It's re-traumatization during the stolen generation. Now what's happening over here? The child is taken from family and culture, right? Something happened, something triggered, and she experienced the same trauma that her mother has experienced, having her child stolen. Secondly, she relives her own trauma of being stolen as a child. She may then slip into further depression and hopelessness, and the cycle then recontinues. In these scenario, when there's a mother who was stolen as a child, and now then she has a child as well, and obviously the mother is not able to provide love and care to the child because she was never given that love and care, and she passed on the same thing to the child as well. And there's a lot of insecurity. There's a lot of self-worth issues, and then definitely that leads to depression. And there's a possibility that she might feel that I never want to marry or never want to have a child because she never got the love she deserved or wanted at the time when she was a child because her mother never had one. So that's basically how the re traumatization can also occur. That's also part of the intergenerational trauma, right? So sometimes it's important to know that where the individual is coming from. It's very important to understand the history, the reason behind the behavior of a child in order to understand where the trauma is coming from. So the child is taken into care, and that's re-traumatization. All right. Now, how can we avoid re-traumatization? That's also a very important part because we have to learn how to avoid re-traumatization, because there will be a lot of clients asking you that I don't want to feel those experience again. So what should I do? Definitely during therapy, the best intention is to help the client get over it, or to be able to manage the symptoms. And even if we have the best intentions, sometimes the therapy or talking about it can harm the child, harm the client, even if we are not aware about it. So trauma informed, it helps us to deal with those things as well. It helps us to bring safety every step of the way when we are dealing with these kinds. All right, so the first one is that we have to use trauma informed approaches. Like I mentioned, that we have to know that what are the trauma responses, what are whether the client is being in the fight mode, in the hyperarousal mode, hyperarousal mode, in which mode the client is. We have to understand that. A client who keep on canceling the sessions, they might not be avoiding you, but they might feel that they are stuck in a flight or freeze response. So we have to make sure that we check in with those clients and we do not pressurize them. Secondly, we have to avoid triggers such as languages or situations that might make the client feel in that same moment. Make sure that we do not make sudden loud noises in front of them, touch without permission, or even use such languages that could be shame inducing. We cannot say that you have to calm down now or you are overreacting. Instead of saying that, we could just say that, I noticed that this is hard for you. Would you like to take a pause? Would you like to take a break? Avoid slamming doors, avoid putting something loudly on the table, because that could also trigger the client. Then we have to make sure that we are mindful of our power dynamics. Like I said, we have to make sure that we are giving the client, we are making our client feel empowered, and make sure that we are not authoritative towards them. We have a very calming tone with them. And we have to prepare clients for intense sessions as well. If there is going to be something that we are going to explore, it's going to be heavy. So we have to inform the client that, are you ready to go there? Do you want to ground ourselves first? Because grounding techniques also help a lot to make the client feel that they are in the right state. Lastly, we have to work at the client space. It's not about healing or winning. It's about feeling safe, and definitely it's going to take some time, but as long as the client is feeling safe, the client is healing. All right. Now there are some red flags that could cause re-traumatization. Just a minute. All right. Red flags. We have discussed all of these flags, but I would also like to mention, if we force someone to retell their trauma before they are ready, we cannot force them. The trigger could be a survival response. They could shut down if we ask something like that. We have to ask them, would you feel okay sharing anything today? Or would you prefer to focus on grounding or safety? We have to make sure that we minimize or invalidate their feelings. Because sometimes clients feel ashamed, they feel confused. So if we hear things like, that doesn't sound so bad, it might reinforce self-doubt. So make sure we are not invalidating their feelings. We have to say that we can see how deeply this has affected you, and your feelings are valid, your feelings are making sense to me. Make sure we're not pushing exposure techniques too early or too fast. Because I'm sure you're aware that exposure techniques, it basically helps you to get exposed to that incident. So if they are not emotionally ready for that, it can destabilize their emotions. So make sure that we are using exposure therapy right on time, when the client is ready, when you are ready. Ignoring cultural or identity-based traumas. Make sure that whatever the client is coming from, the culture, the race, the identity, even the religion, because it shapes how they feel, how they express their emotions. So if we start overlooking these, they can make someone feel invincible. Make sure that we do not tell a refugee to just move on. Or if someone coming from a displaced area, if we talk about, okay, it's okay, it's not a big deal, so that going to disturb them. We can have to talk to them that is it okay if we bring culture during the therapy? Do you want to talk about your culture? Do you want to talk about your race or identity? Lastly, being dismissive of physical responses like dissociation or panic. Definitely, as we mentioned, that dissociation or panic is part of the trauma. So make sure that we are validating their physical responses as well. We cannot just say that we have to focus during anxiety attack. Obviously, we have to tell them that, this is overwhelming. Let's take a pause. Let's take a break. I'm with you. I can understand your emotions. Right? So we have to make sure that we validate each and every experience or emotion our client is feeling. All right. Let's get to reaction and responses now. Now, reaction and response is basically the 5 F's, like I mentioned. And that's right. So the 5 F's of trauma responses, it refer to the five instinctive survival strategies people use when faced with real or perceived threats. So whenever we encounter a threat, whether it's real, whether it's perceived, our nervous system doesn't wait for us to think. It reacts intensely, immediately. These reactions, they are basically the survival mechanism, which is rooted in the mechanism. Survival instinct that is rooted in the mechanism. So originally, they are basically designed to protect us, but sometimes they become so involuntarily that we are not able to control them. And it depends on how the trauma has shaped our responses, shaped our nervous system. So the first one is fight. That is basically, when the individual becomes aggressive, when the individual become defensive, and they try to face any threat aggressively. They start yelling, they start shouting, they start screaming, right? And they might be just trying to protect themselves, defend themselves, because they don't want to feel any shame or reject. So what they do is they start lashing out to the other individuals. That's fight response. Then we have flight response. That is, they start running away from danger or threat. Right? So when they try to leave the situation quickly, when they try to get out of the situation, and they try to avoid conversations, they try to avoid therapy as well, and they are running away from it. All right. So flight response is when they try to run away from the situation. They try to escape the situation. They don't want to talk about it. They don't want to take therapy. So they are basically again trying to protect themselves, but it comes out as they are running away from the situation. Then we have freeze response. That's when they are not able to move or react against a threat. They feel frozen in the fear. I'm sure anyone who would like to share any of their responses that they have ever felt regarding any trauma that they experience or the client shared something like that. Once I'm done with these 5 F's, I would like you guys to share that as well. Then we have fawn. That is to please someone to avoid conflict. They are basically people pleaser or appeasing that what they do. They try to over apologize. They try to say yes even when they want to say no because they don't want to express disagreement. Okay, what they do is they just go with the flow and they always say yes to whatever they are being asked to. Right? So that's fawn. And lastly, we have flaw. That's collapse or total shutdown. When they are in the extremes, when they are in the extreme stress, they are not able to, deal with it. So they just shut themselves down. And they, again, they are trying to protect themselves, but that the reaction comes involuntarily. So, any one of you who would like to share any of the responses their client have ever experienced with them, or if you have ever experienced any of these responses, please go ahead, and I would like to hear some from you guys as well. When do you use, if anyone have ever used any of these reactions, responses in their life? Because it's important to know that these responses, they are not weaknesses. They are basically brilliant strategies that our nervous system have developed to keep us alive. It's important to know that healing always comes when you start noticing and not judging. And when we are in therapy or when we are talking to a therapist, always know that it's always a safe space with no judgment, with no uh, unasked advices. Anyone who would like to share something, any responses, any survival strategy that you have ever used, please go ahead. All right, I think let's move on. All right, the last part of the cycle is coping or avoidance. Avoidance. Definitely to manage these intense reactions, they try to engage in a coping mechanism, which can often involve avoidance of the trigger, the feeling, or even the memories themselves. So instead of coping, they start avoiding. Let me share some examples with you. Right. So what they're doing, they are coping by avoid thinking about what happened. Now, this is their coping strategy. That they're just going to avoid whatever happened. They want to avoid the feeling that is associated with that event, avoid the feeling of being stressed or anxious. And instead, what they're doing, they're not dealing with it. And they're obviously still anxious. So that's avoidance coping strategies. Those strategies that they have developed to cope with the stress, but instead they're just avoiding it, not talking about it, avoiding all reminders, using drugs or alcohol. These are all avoidance coping strategies. They are pretending that if they do these things, it might make them feel better. It might not give them unpleasant feelings. But what they are actually doing is they are prolonging their anxiety. They are creating dependence. They are restricting what you can and you cannot do. Thank you so much, Una. It's okay, you can leave. We are also, we were happy to have you. Recording will be shared to all of you, I think, so it's okay. So these are some avoidance coping strategies that you can use. All right. That's the cycle, and it was very informative. I really liked the cycle, and I wanted to share with all of you that this is how the whole cycle is being processed. All right, now let's discuss some of the most effective and most scientifically supported approaches that is used to help individuals who are going through trauma. And we call these techniques evidence-based trauma-informed techniques. And these techniques are basically designed in a way that can help to understand the trauma and definitely the deep impact that trauma has. So when we are doing when we are doing trauma-informed therapy, we are basically using these evidence-based techniques. So the first one is EMDR, that's eye movement desensitization and reprocessing. I'm sure if we have someone from psychological background, they're aware of it, and it's basically highly structured therapy sessions where clients are basically recalling their distressing events while simultaneously they're focusing on external stimulus as well. Most commonly, they are following therapist's finger or a light bar with eyes side to side. And basically, how it works, You can think of it like your brain is processing memories during REM sleep. So when trauma happens, memories can get stuck or even improperly processed, which leads to flashbacks or nightmares. So EMDR, it helps you to unstuck those memories and reprocess them in a way that can help you to reduce your emotional damage. All right, then we have, obviously, I'm not going to go in depth of each techniques. They require, I think each technique require a separate workshop. So I am just giving a brief right now. If you have any questions regarding any technique, feel free to ask me. Right, then we have trauma-focused cognitive behavior therapy. This is basically, it's a traditional cognitive behavior therapy that is tailored specially to address the unique challenges of trauma. TFCBT, it helps the clients to alleviate distressing feelings, distressing thoughts that is linked to trauma. In this therapy, the client is basically asked to identify or challenge the unhelpful thought pattern that is linked to them after the trauma incident has happened. And that's the cognitive part. And then they learn new or healthier ways to cope up with it that involves psychoeducation, relaxation techniques, emotional regulation, and gradual exposure. And then we have somatic experiences. Then we have somatic experiences. Now, this approach focused on body sensations. Like we discussed that there is a lot of somatic symptoms as well to those individuals who are linked with trauma. So this is very beneficial for those individuals because it focuses on body sensations and it aims to release stored tension that stems from traumatic experiences. Someone who have, a pain in their shoulders or in their muscles or in their stomach. So for those individuals, these techniques are being conducted. इसमें ये होता है कि rather than talking about the trauma, what we do, we try to focus on the physical sensations. कहाँ पे, pain है, पेट में कहाँ दर्द है, shoulder पे, which part of the shoulder is being tight. And the goal is that we allow the body to complete the natural fight, flight, or freeze response that were interrupted during the traumatic event. Right? For example, if someone froze during an assault or during any abuse, they might hold they might they might hold any chronic tension in their shoulders. They feel continuous pain in their shoulder. So the therapist is going to guide them to notice that where is that tension coming from. And through gentle movement and through gentle awareness, we're going to help the body to discharge those tensions from the body. And the tension that's being trapped in the shoulder, it has trapped energy that is linked with the trauma. So it allows the body to release those tensions, to feel safe in your own body, and for releasing all the negative associations that is linked with the trauma. एंड इसमें हम PMR उनको करवाते हैं मसल प्रोग्रेसिव मसल रिलैक्सेशन टेक्निक्स होती हैं जिसमें आपका हर एक बॉडी पार्ट को रिलैक्स करवाया जाता है एंड योर माइंड इज इंटायरली फोकस ऑन ईच स्पेसिफिक बॉडी पार्ट दैट्स वेरी बेनिफिशियल वेरी हेल्पफुल फॉर दोज इंडिविजुअल्स who are going through somatic experiences. All right, then we have sensory motor psychotherapy. It basically helps the client to feel more attuned towards their bodily sensations, and awareness techniques are used to process the traumatic experiences. It basically helps the individual to understand the story the body is telling them about the trauma through their postures, through their gestures, through their bodily movement patterns. And it works on the area that you need to heal not just your soul, but your body as well. Because, like I said, our body remembers the wounds, even if we don't have words to express them. So, this technique focused highly on our bodily sensations. Last but not the least, we have mindful practices like we have already discussed. We have grounding technique, we have deep breathing, we have, we use five senses and we bring ourselves back to the a present moment. In these techniques, it helps us to tell ourselves that the trauma was in the past and we are not going to bring then to now, because now we are over it. Now the trauma is not surrounded by us. It was in the past and now it's time to let it go. So these grounding techniques help us to get back to ground. All right, now moving on, that how therapy rewires the trauma brain. Definitely, trauma can help you to rewire the brain for survival. When to use fight response, flight response, therapy can guide you towards that. Therapy can also guide you to create new neural pathways. Because, like I said, the role of amygdala, prefrontal cortex, it's disturbed due to trauma. So, therapy can help you regain the control and can create new neural pathways as well, which is called neuroplasticity. And the result over time is it helps you to be calm, it helps you to feel flexible, to feel empowered, and feel in control. So we have uh, evidence-based research that therapy can help you rewire your traumatic brain and can help you get back on the ground. All right, I have a healing menu with me. जिसमें I have compiled all these strategies, all these techniques into a PDF file. And because, like I said, that there is no one size fits all to healing, and that's a good thing. We have variety of techniques that can help you. So I want all of you to share your email IDs on the chat box, or you can just send it to Ms. Rabia, and she can send it to me, and I will share the healing menu to you in the after the session. I will email that to you. All right. All right, now we're going to do a little case study. I want all of you to be attentive and read the scenario, and then there are some questions that I want you guys to discuss. Ma'am, is it possible if I divide them into break rooms and then they can discuss with each other? We have 1, 2, 3, 4, 5, 6. I'm going to divide you guys in the breakout room where you can discuss this case study, and then I will divide you guys into pairs, and then you can discuss with each other about this case study, and then you can answer me. Let me just see how can I do that. I'm dividing you guys into breakout rooms. I think you guys are in your room. Are you guys in your room? I hope so. अमीना प्लीज आप भी रूम ज्वाइन कर लें. All right, I'm going to close all the rooms. All right, welcome back. I hope that you have discussed with each other. The case is that Sarah is a 28-year-old early years teacher. Over the past few months, her colleagues have noticed that she becomes emotionally reactive during staff meetings, either shutting down completely or becoming defensive when receiving feedback. She avoids social gathering at school, often eats lunch alone, and recently broke down in tears when a parent mildly questioned her teaching approach. In private, she shared with one colleague that she had a difficult childhood and is trying hard not to mess things up. So the first question is, what trauma signs are visible in Sarah's behavior? Have you guys discussed with each other?
I joined the room, but I couldn't find anybody over there. So, but I
All right.
would like to share. She is emotionally reactive and shutting down, and then it's like avoidance basically.
मैम
So three
Perfect. बिल्कुल
signs are.
सही. Anyone else?
You can see the anger and irritability. You
Anger
can also
and
see how the behavioral symptom of withdrawing.
behavior symptoms of withdrawal. ठीक है, बिल्कुल सही. Anyone else?
मैम इसमें एक ये भी सिम्टम्स थी, लो सेल्फ एस्टीम, लो सेल्फ वर्थ थी, फियर ऑफ फेलियर, ये सब था.
Low self-worth थी, fear of failure था, बिल्कुल सही. All right. Now, what assumptions should we avoid when interacting with Sarah? What do you guys suggest?
That she's not angry without any reason, and she's not behaving appropriately. These are the some assumptions I think we should.
Yeah, बिल्कुल सही. Perfect. Excellent answer.
Also, we shouldn't think that she's incompetent or is not a good teacher. So maybe look into why she's reacting this way.
Yes. Definitely. What we should avoid basically labeling her or putting her into the pressure of giving any judgment. Okay, perfect. Now, using trauma-informed care, how can you respond supportively as a colleague, as a supervisor, or mental health professional, or even as a colleague or a friend? How can you respond to her?
I think first of all, if somebody is aware of how to deal with it, like in a very protected manner, I would say like maybe as if you are not an expert, refer her to somebody like who is an expert first of all. But if you can, then first thing is like providing her with a safe space where she can open up, like if she is ready to talk about it or not. That could be the first thing I would suggest.
Perfect. Excellent. Thank you so much, Zobia, because we should give her space to open up and not force her to, we should avoid forcing her to tell that what's going on with her. ठीक है. Anyone else? आपने इनको
मैम उसको encourage करेंगे,
जी
encourage
जी
small manageable steps towards social engagement without pressures.
बिल्कुल सही. परफेक्ट. एक्सीलेंट. ठीक है. वन लास्ट पार्टिसिपेंट, वो भी बता दें. एक और पार्टिसिपेंट प्लीज बता दें कि और किस तरह से इसको कर सकते हैं. Something about our tone, something about our voice, how to speak with her regarding her experiences, how to make her feel safe. All right, last question. What changes can the school workplace make to better support individuals like Sarah?
I think the most important thing is that spreading awareness. So the staff is educated enough and knows about trauma-informed care and are able to recognize the signs of trauma and manifestations of trauma.
ठीक है, बिल्कुल सही. ठीक है. Anyone else?
And without triggering Sarah for a particular emotion she is expressing, to give awareness to everyone that it could happen, and these are the signs. So if it's a generic conversation and awareness sessions, those kind of, so he can feel safe that it's okay to feel that way, and providing professional help or providing professional counselor over there in that school, so the people can reach out to them in the whenever they want to.
I think it's necessary for every school place or workplace to have a counselor so that they can talk to them or discuss the symptoms that they're experiencing. Excellent. Perfect. Thank you, everyone, for reflecting on this case study. Excellent. Perfect. Well done. All right. Trauma informed you. How can we support others safely? When someone is opening up to you about trauma, make sure that you are not saying these things. All right. If you tell someone that this will make you stronger. Now, definitely, while resilience can emerge from overcoming adversity, this statement, it basically minimizes the pain and it makes the person who is suffering the pain more intense, with more intense. It's basically suggesting that whatever happened to you, it was a lesson. It was a character building exercise. So now they are feeling dismissed. They are in pain now and they're not looking for a silver lining. So if you tell them that the trauma is going to make you feel stronger, it's not going to work out for them. Right? Imagine if someone is grieving the loss of a loved ones, right? And they come to you and they tell you that, I lost someone and now I'm in pain. And you tell them that, oh, this will make you so strong. So definitely the person is going to feel cold and they're going to feel like my emotions are not being validated and it's a wound. It's not a workout that you're just telling me that this is going to make me feel stronger. Then avoid saying that you will not heal until you forgive. No doubt, forgiveness is a deeply personal and complex journey, and it's not a prerequisite for learning, for healing. It's basically you are telling the individual that you are pressurizing them that if you forgive them, you will move on from your suffering, right? It can make the client individual feel re-victimized. We are placing them into the same emotional labor that they had. We're asking them to just forgive your pain. It's not about forgiving the pain, it's more about living with the pain or managing the pain. How we are going to heal. Lastly,
Can I add something?
जी जी.
Yeah. And again, it's like when we try to give a rosy picture to any trauma, like the collective incident of APS, where like kids were killed brutally and people were telling their parents that, oh, wo to shaheed ho gaye. No, they
Yeah.
they didn't go to the school for that kind of entitlement. They were there and they suffered. How can you give that statement? And this is something really broke me into pieces, that how can you make it like such a rosy picture?
Hmm. And it's true. It's happening around us. People are behaving like this, and they are saying these things to the victim or the individual who have been through this situation. All right, talk to me. You won't get better until you talk about it. Definitely, I understand that this is what we do in the therapy. We ask the client to talk about it because talking itself is very therapeutic. But if you force someone or we imply on them that that's the only path that is made for you to heal, that can be harmful. Because if you force someone when they are not ready to talk about it can be re traumatizing for them. It can make them feel unsafe. It can make them feel pressured. So it's better that you use different modalities, not just verbal processing, especially during the initial phases of trauma. During the initial phases of trauma, it's better that you are just being present with them. Even that's more than enough. You don't have to speak, you don't have to ask them to speak. Just being there for them silently can also help them heal. Now, what we have to say instead? Instead, we have to say that it's not your fault. I believe in you, because survivors of trauma, they do carry guilt, they do carry self blame. So when they hear that it's not your fault, it can make them feel powerful, because victims are often disbelieved or they're often doubted, so that adds a layer of secondary trauma. What you can say, however you are feeling, is valid. It's really important to validate their feelings. They are feeling angry, they are feeling sadness, they are numbness, there's a mix of emotions after the traumatic event. So, whatever they are feeling, it's not right or wrong. Whatever it is, it's valid, it's justified. We understand that you feel like this. Lastly, what do you need? I'm here for you. Now, this statement can actually empower individuals by giving them the agency. This statement, it shifts the focus on from what you think they need to what they actually need in that moment. And that definitely shows support, and it helps them to heal as well. This statement. All right. Worst things to say to someone whose trauma has been triggered. You are overreacting, right? That statement, that the trigger is just not an overreaction to the present situation, it's a very real re experience of past trauma. So, when you tell someone that they are overreacting to loud noises, they are overreacting to anything that could trigger them again and can make them feel guilt, make them feel in pain again, and they might start shaming that why did we even discuss with the other person or share with the other person. It happened ages ago, get over it, right? There's no expiration date of trauma. The brain and body can hold to traumatic events for as long as they want. So that you can never say that it happened ages ago, now just get over it. Even if it's 30 years ago, you can never say that to anyone. Lighten up, it's not that bad, right? It's similar to overreacting, and this basically minimizes the experience and it suggests that the feelings are not valid. You are crazy. It's all in your head. You're such a buzzkill. These statements can deeply negatively impact the individuals. If someone is having dissociative episode and if you call them cruel, that's not just, if you call them crazy, that's just not harmful to them. It's actually harmful to their brain as well. Their brain is not going to understand that am I actually going crazy or not. They start being confused about their own behavior and experiences, right? So we have to be patient to them because healing takes time. These statements makes the things really worse for them if you tell them that stop being dramatic and you're just using people have been through worse and you're using it as an excuse, they makes the client feel that whatever they are feeling is not being listened or supported over here, and that can harm the individual in a more worse way, right? Healing takes time. Whoever is going through that, our role is to be compassionate, our role is to validate and avoid these unhelpful phrases because they're not helping them at all. All right. Now, what are the questions to ask when someone is who is struggling to open up? Okay, now this is a very common scenario that what should we do when someone is clearly struggling, when someone is not being able to talk about it? You can always start with how are you feeling today? Instead of saying that are you feeling upset? Are you feeling are you in pain? Are you still missing the person? Just ask them that how are you feeling today? We are offering them, we are inviting them to speak about whatever they want rather than demanding them to speak about the trauma. I'm here to help you. How can I best support you? Let them tell you even if whether they need your support or not. Is there something you wish people understood better about your situation? What isn't supportive right now for you? Ask them that, what help do you need? They might say, could you just listen to me without trying to fix me or without giving me any advice? Because that allows the specific support they need. Do you find it easier to write your thoughts and feeling down? If they say yes, then ask them to just start journaling or start writing down their feelings. Now, these are some of the questions that can help them to feel that you want them to listen, that you are listening to their problems and you're understanding their problems, and you're not just there out of curiosity to know the story behind your behavior. You're there because you want to support them and you care for them. These are some appropriate questions and things to say. All right, let's summarize our key takeaways and let's look at what it truly means. We discussed what it truly means to be trauma informed. It's basically a fundamental shift in how we understand and interact with individuals. It's important that we recognize their strengths and we applaud their strengths and how they have been coping so far. It's really important to meet the survivor where they are at. We have to respect their pace, we have to respect their current state in order to help them heal in this journey. Make sure that whatever direction we are having, we are focusing on not bringing the trauma again. We don't want them to feel re-traumatized because of us. We have to create safe environments. We have to prioritize their needs, their choices, and empower them in their own healing way. And most importantly, it means not seeing survivors as problems to be fixed. Like I said, instead, we ask what happened to you rather than what's wrong with you. It means that we are understanding their struggles, we are understanding what's going on with them. All right, on this note, let's do a closing self compassion exercise. We're going to take a quiet moment and we're going to place one hand on our heart or somewhere you feel comfortable. And we are going to gently say to ourselves that I'm doing the best I can with what I have been through. It's okay to feel, to pause, and to need support. I deserve the same compassion that I offer to other people. We're going to take 3 deep grounding breaths. I hope that you all followed with me because this exercise was much needed and I'm sure that it helped you. All right. Before ending this session, I want to hear from you guys that When I feel triggered or overwhelmed, what would I say to a friend in my place? And how can I say that to myself today? Any statement that you would want to say to a friend if he or she were triggered or overwhelmed for any situation that they have been, what would be that statement? ऐसे क्या स्टेटमेंट आप देना चाहेंगे? It will not always stay the same. This too shall pass. Definitely. Thank you, Sumaya, for saying that. Anyone else, please? All right. Definitely, the whole purpose behind doing this is to tell you guys that trauma creates change that you didn't choose, right? But healing is all about creating the change that you do choose. So make sure that you are focusing on healing, you are working on the healing journey, and you are working on yourself as well. Thank you so much for being here with me today. On that note, we are done with our workshop and Miss Rabia is not here, I think. Let me call her, I think so. Anyone who would like to ask anything, wanna speak about anything, please go ahead.
Could you please let me know if you want to become a trained trauma-informed therapist? So what would be the way of doing it? Because I think it's a very, very sensitive area and it needs expertise. And what are the techniques you need to have good grip on?
Right. So I think the most important thing is to be empathetic when you are dealing with such sensitive cases. And you have to be actively present when you are working with such clients. You have to make sure that you are not being distracted by any other surroundings and your mind is fully present in the moment because trauma survivors are able to detect very easily. They are already very conscious about themselves. So if they notice that my therapist is not being present fully, they might, start hesitating, and they might feel that they are not being comfortable in that place, or they're not being heard. So being empathetic, actively listening, and I think a lot of practice. ट्रॉमा इन्फॉर्म्ड एक ऐसी थेरेपी है जिसमें यू नीड टू प्रैक्टिस अ लॉट, एंड द मोर यू प्रैक्टिस द मोर यू लर्न अबाउट देम। एंड ट्रॉमा के बारे में सीखना और पढ़ना भी बहुत ज़रूरी है इन ऑर्डर टू डील विद सच क्लाइंट्स। राइट।
Thank you so very much, Afra. Yes, thank you so very much for for such an insightful session. This is absolute, it has always been an absolute honor to have you, young trainees and trainee psychologists. And I'm sure the audience must have benefited from the session today. And this will not just only help them in their practice, but also in terms of their general knowledge and, clarify some misconceptions about trauma and trauma-informed therapy in general. Yes, with this, if you allow, there are a few questions. If you would like to address them, or what would you want, or should we just conclude the session because the time is up already?
Ma'am, I think there's only two questions. I think I'll just reply to her and then we can conclude. What do you think?
Yes, of course. You can go ahead if you want to reply to that, or if you've replied to that already, because you've quite comprehensively replied in the first part of the question. So if you still want to go ahead and address that, that's completely fine, and then we can conclude the session.
All right, ma'am. All right. Yes, Aksa, I have already discussed the first part of the question very thoroughly, but just to summarize it, I would just like to say that it's not just limited to having knowledge of trauma or reading about trauma or learning about how the trauma impacts us. It's more about being consistent in your practice. It's more about learning the principles, those core principles that I mentioned early of trauma informed therapy, being consistent on that, having them on the fingertips, and actually implementing those principles when you are working with them. Like, make sure that you are prioritizing safety, you are avoiding re traumatizing, you are empowering the client with choice, and make sure that it's a collaboration with them rather than you being bossy or ruling or owning the session. Try to give authority or the empowerment to the client and let them decide when they are ready. I think these are some tips that would help you to help you what to truly help you remain truly trauma informed when you are working with these clients. Second question is that in your experience, what are the common mistakes therapists make while claiming to practice trauma informed care? Right. I believe that the common mistakes that I've noticed in my own experience is sometimes they rush into trauma processing. And I believe that the initial sessions, especially maybe 2 sessions or 3 sessions, they must focus on building safety, building regulation with the client, rather than you ask the client in the first session that tell me about it. What happened on that day? What's going on with you? So we don't make sure that you first build the safety, the trust, and then you work on the trauma. Second thing is they sometimes skip self-reflection and supervision. That can also lead to unintentional re traumatization. Especially working with trauma individuals, I believe you require supervision. Discuss with your supervisors, with other professionals. Take advices, take help. I'm doing this. What do you suggest? What else can I do with this client? How can I do with this client? So I believe if you keep on reflecting on yourself, that's also going to help you avoid mistakes and help you to actually help the client heal during their journey. Right. I think that's it. Anyone else who would like to say anything? तो वो आप कह सकते हैं.
Yes, thank you so very much, Afra. It was very comprehensive, and I think, you've very well explained the whole, regarding the questions that were asked. Thank you so very much for your time. I think it's time to end the session now. Thank you everyone who've joined in today, and we look forward to all of you attending more sessions in future. Thank you so very much, Afra. I'm now going to end the session. Thank you.
Thank you so much. Allah Hafiz, everyone. Thank you.
Thanks. Hafiz.